using the Legend Pro Voluderm on Kim today to get some collagen stimulation and tighten up her fine lines on her face. She also just feels over time that she's lost some of the volume in her face, and so we want to stimulate that and give her a little bit of a lift, a more refreshed look. So we are doing the Voluderm on the lower setting, a 36 ultra thin micro needle, and so I did two. I did a moderate level here, and this is the lower level. I'm going to go ahead and do the lower level energy all the way through, which is at a 10% power setting of the total 50 watt capability, and it's 15% of the exposure time, with 400 millisecond being the highest. So with the Voluderm, you press slightly, press your foot pedal, you feel a slight vibration, and then you see the green light, which means you're done. So you can see right after there's really no change, and you get this slow, delayed erythema, slow, delayed pinkness. You do a 50% overlap, pulling the skin away and off of the bone. So you can see that on Kim, she gets a very delayed pinkness. Right after the pulse, you don't see much change. But heat is being generated by the radio frequency. And Kim, how does this feel?
Feels fine. I can feel a little bit of a pinch. Then I can smell the heat. But it's definitely tolerable.
On a scale of 0 to 10, with 10 being the most pain, what are you feeling now?
2 to 3.
2 to 3.
Yeah.
So that's good.
And it varies on different spots in my face. The fleshier areas, I notice I don't feel it as much. Where the areas are thinner, I feel a little bit more.
And that's a good point. You know, we're using the lower setting, but when you're doing more aggressive settings, you can do a higher energy all the way around, but then when you're over sort of thinner skin or more bony areas, you can lower your energy setting and do sort of differential treatment. You want to pull the skin away from the orbital bone in this region. And then we're going to go back over all of her skin in a different pattern. So we're going to start back at her jawline area. We want to make sure we get this forehead because she has some fine horizontal lines across the forehead, as well as some pigment change. So turn it 45 degrees and go back over those areas to make sure that we really have gotten every single portion of her skin. And you can see some delayed perifollicular, some delayed edema, I'm sorry, right around where those microneedles are. So you can see where the placement was. So when I push gently and then press the foot pedal, and I can feel the slight vibration, and then the green light indicates that you can move on to the next area. Turning my handpiece 45-degree angle to the initial treatment. So it's a good result. So this light delayed erythema that you see, you can see a little bit of edema from the micro needles, and as the heat starts to sort of build and increase with the second pass. And we're going to be using just a light mist on Kim's face, and then in a day she can start using her moisturizers. Usually some sort of healing, wound healing lotions are appropriate. We can use Aquaphor, aloe creams, hyaluronic acid serums, and then generally this is repeated every 1 to 2 weeks. Usually you'll do perhaps 3 to 4 treatments and then pause and see what kind of collagen build you get, see what kind of lifting effect you get, and then you can go back and do additional treatments as necessary. Thank you. Thank you, Kim.
So the second treatment I had was the Legend Pro, and that was with the micro needling. That felt a little bit more intense. I could feel what I described as a poke, but it looks like there were multiple pokes that I was actually feeling. And maybe just a little bit more heat from that treatment, but very comfortable, very tolerable. And now I just have maybe 20 minutes past the treatment. I can feel a little bit of heat coming from my skin, but I would say that's it. Obviously, I haven't seen yet what the result will be, but I can tell you that it's very comfortable, that there is no pain associated with it. And at this point, I was planning to go back to work. Looking at myself, I think it's okay if I could go back to work. There's no need for me to have to go home. I'll spend the weekend kind of nurturing my skin and hydrating, but I would absolutely recommend it. And I'm expecting a really great result. And I can say that if I get that result that I'm expecting from what I went through, it is well worth it.